To talk about COVID-19 and its relation to cardiac disease, we should start from China. In early cases of COVID-19 in China, acute myocardial injury was identified as being associated with a worse prognosis, maybe due to microvascular damage, myocarditis, hypoxemia, cytokine-mediated injury, or stress cardiomyopathy. The Spanish Society of Cardiac Imaging recommends echocardiogram use should be limited, even in critical patients, to certain subgroups of patients like heart failure, arrhythmias, ECG changes, or cardiomegaly. But others say that transthoracic echo is a part of routine care of COVID-19 pneumonia patients to assess chamber size, chamber function, valvular disease, or pulmonary hypertension. They found right ventricular dilatation, right ventricular dysfunction, and right ventricular impairment was associated with high levels of D-dimer and C-reactive protein. European Society of Cardiology studied this number of patients with confirmed COVID-19 from 69 countries with previous cardiovascular disease. They found that 55% had an abnormal echocardiogram, 39% had left ventricular abnormality, 33% had right ventricular abnormality, 3% had new myocardial infarction, 2% had Takotsubo cardiomyopathy, 15% had severe ventricular dysfunction and or tamponade. 8% had pulmonary hypertension, and 3% had myocarditis. Echocardiogram abnormal findings were in more than half of all COVID-19 patients. This changed the management of 1/3 of these patients. So echocardiogram is a very important tool to define the way of management of COVID-19. We have to concentrate on myocarditis. In conclusion, in COVID-19 patients, echocardiogram is very important to diagnose pulmonary hypertension, right ventricular dysfunction, Takotsubo cardiomyopathy, ejection fraction, and myocarditis. Myocarditis is associated with low ejection fraction, and it's of two types: acute myocarditis and fulminant myocarditis. Acute myocarditis has a thin wall, dilated cavity, and low left ventricular function, while fulminant myocarditis has a thick left ventricular wall, non-dilated cavity, but hypocontractile wall. If you like this, please share it. Wish you good luck.